everything after line 3.
I'll call the meeting to order.
Yes, we'll start at your deleting line 1.4.
I want to,
Hear you. Microphone.
first thing is recess, not right now, but if we don't get done here at 11:30, we'll recess and come back at probably at 6 p.m. or call to the chair. And we will finish up by 11:50. If we go that long, we're going to vote at 11:50 whether we've done all the amendments or not.
Mr. Chair,
Yes.
We can't hear you. If you could pull the mic closer, we missed most of that. Sorry.
Okay. I will repeat that then. If we don't finish this bill by 11:30, we will have the call of the chair. It'll probably be about 6 o'clock in this room. And I will say that if we don't finish by 11:50, we don't have all the amendments done, we're going to vote on the bill at 11:50. Now, hopefully, it won't even be close to 11:50. But I just want folks to know, and when somebody is testifying on or discussing an amendment, they should keep their comments to the amendment. So, with that, I would renew my motion that House File 2150 be re-referred to the Committee on Ways and Means. And then I would move the delete all. And I would move the 976 amendment, which is the delete all one, which we discussed on Tuesday. It's A140976. And if you don't have that copy in your folder, the page has a few extras. And yeah, it was handed out on Tuesday. Yep. And there's a few extras you don't. Oh, you found it. Anybody else? Okay. So, any discussion of the delete all? Then it'll get the bill in the way I want it, and then we can start. Yeah. Yeah.
Well, you wouldn't have to.
So all those in favor of the delete all amendment signify by saying aye. Aye. Opposed? So we now have the delete all amendment before us, which was discussed on Tuesday, and I then have a number of other amendments. The first one is the A6 amendment, and this does a number of different things. It puts in that the Thief River Falls Hospital's expansion is going to be a 16-bed expansion, but the reality is they already have 10 mental health beds, so they're going to 16. So it's, in reality, it's a 6-bed change. And the next sections, 1.6 to 1.9, relate to the Amplatz Hospital and their technical corrections. Lines 110, 111 refer to the Healthcare Homes Advisory Committee and says that the appointments shall ensure geographic representation of all regions of the state on that committee. And I believe the rest of everything is, after that, is pretty much technical. I don't know if staff wants to run through any of that. Or are there any specific questions on that? And maybe somebody could explain to me what the MFIT child care assistance appropriation difference is. Mr. Byrd.
Mr. Chair, if you want just for the finance changes that happen on lines 2.31 through the end of the amendment, they do exactly two things. They change the budget activity for the administrative fund, $6,000 in administrative funds on the spousal maintenance bill in MA. That was coded as one budget activity, and after Tuesday, Department of Human Services contacted me and said it should be in another budget activity. And similarly with the child care assistance TANF funding for Representative Allen's bill, it was coded as one budget activity, but it actually technically that falls in the paragraph that's referred to as technical activities. So this just moves it from one section to another. But otherwise, these changes don't change any of the spending in the bill in any way. They just redefine the budget activity on two small items.
Any questions?
Mr. Chair.
Representative Abler.
Thanks. I just have one question. On page 84, line 13, we're taking the Disability Law Center out of a group they're going to work with. Usually we actually add them into groups they're going to work with. Did they just not want to be on this group? Yeah. They don't want to be. Okay. Thanks. They're busy. Okay. We'll give them a break. They do a lot of good work.
Okay.
Thank you.
Any more discussion of the A6 amendment? All those in favor signify by saying aye. Aye. Opposed? So the A6 amendment is adopted. Next we have the A58.2. And is this the one that was late?
Mr. Chair, I believe that's mine, although I don't see the A2. Oh,
It's coming around. Okay, and this bill did not make the yesterday at 3 p.m. time limit. It was about 20 minutes late, and it was because the original bill had a drafting error in it, so they redrafted it.
So you received the A58-1 on time. The A58-2 came from research a few minutes later with the changes that are minor and technical, I believe.
Yeah. Okay. So is that?
This is my amendment. Members, what I've done here is take a bill that passed last year in this body but wasn't funded, as well as two bills that passed this body already, and a Loeffler bill and a Rena Moran bill, and combine them to address what I hope is the start of some work by the Department of Health on minority health disparities. And this is really my attempt to get the department really moving because of the racial disparities report that came out, and we need to move forward and address those issues and not just have a report sit on the table, which I know they're not doing, but this is a more aggressive approach. So I've rolled in Representative Moran's bill, Representative Loeffler's bill, the bill from last year for the women's Somali health disparities, and added some money. I've taken money from the school, recovery school funding that is going to be funded elsewhere, and have put it into this minority health disparities program, or program's probably the wrong word, but plan, and it will allow the department to issue grants for the programs that I've just described and others. So really hope we can have your support for this.
And if I could just comment on that. Yesterday I went with Commissioner Jessen to the Somali group that was authorized to do the navigation for the to get people signed up if they were eligible for public programs or for MNsure. And it's something I already knew, but until you actually see something, it really makes an impact. And their population is very different than other populations. You just can't write a plan for everybody because it won't work. One of the things I learned is they sent their navigators out. There's 2 malls in Minneapolis that are primarily owned by Somali businesses, and that's where every Somali goes on the weekends. And who would have ever thought that? So they sent the navigators out to the malls on the weekends. And their goal was to sign up 500 people. They've got 1,000 people signed up because there were over 1,000. And so all these groups are different, and they need to be treated different, and we can't just assume that everybody's the same. So I would support this amendment. Representative Liebling.
Thanks, Mr. Chair. And I just, as we're looking at the language, Representative Loeffler and I just noticed a few like tiny little, really technical things. I think we'd made some changes in the language of some of this when it came through, and that might not be reflected in this amendment, but I think we can fix that later on. It's nothing substantive, and so I think this is a great direction to go, and I appreciate Representative Norton working on this, and agree with the comments from the chair that this is a really important direction we need to go. If we're really serious about the health of Minnesotans, we have to start closing that gap, in that health inequity gap. And I think that this is a great amendment with our tiny little budget target this year. To still be able to start moving forward with some of this, I think would be just terrific. Wish we could do a lot more, but I think it's a great start. So thank you.
Representative Quam.
Thank you, Mr. Chair. In connection with Representative Liebling's comment about some minor things, because of the rush and the deadline activity, could I make the suggestion that those type of corrections could be presented, any discrepancies, so that they could be in a technical correction amendment on the floor instead of rehashing those on each specific amendment?
That's a very good suggestion. That's I think some of these corrections can be made in Ways and Means, which I think will be on Monday, but they don't like too much technical correction. So you're correct. We could have a bill on the floor that makes all these little technical things, and it shouldn't take a lot of debate.
Mr. Chair.
Representative Abler.
Yeah, Mr. Chair, maybe Representative Norton. So how much this remaining funds on line 3.20, how much money is remaining, like 300,000 or 400,000 or something? Is this 800,000?
About 200, a little over 200,000 will be left for the number 4.
Yeah, that's a good amendment. Thank you.
Any further discussion? Seeing none, all those in favor of the A58-2 amendment signify by saying aye. Aye. Opposed? So the A58-2 is adopted. And next, I have my list here. The A25 amendment. What is that? That's Loeffler's amendment. Representative Loeffler.
Thank you, Mr. Chair. If I can borrow someone's, I don't see it in my packet. A25.
Not our packet.
We don't have it. Nope, I don't have it either.
Mr. Chair,
What?
staff do an amazing job with a lot of paper.
Why don't we just delay that one for a little bit?
Thank you.
Start going through this. A1. Okay, we have an A1 amendment. Who's offering that
Mr.
one?
Chair.
Representative Abler.
Mr. Chair, this is from ARM, and do you want to come down? I'll just let them testify about it. There's, in 2011, we worked to move people into community settings, and to save money and move people, we closed 128 beds.
Okay.
The department might want to comment about how many beds actually were closed. It seems like it's 90, but I'm wondering if some weren't counted. But anyway, this is an amendment about what they're going to start doing is just grabbing beds that are going to cause some harm in the system. And so I'll let the testifier talk about it. And I think the department's okay with this. I don't know, but I hope we'll have to talk about that. Are you, yes?
Welcome to the committee.
They're smiling, Mr. Chair. So we have a smiling department in the audience. So.
Thank you. I'm Barb Turner with ARM, and the department is okay with this provision. Basically, what we're trying to do is give some direction to how the last beds that need to be closed, how they're identified. And we know that there are currently programs out there that are licensed for 4 or sometimes 5 beds, but are operating at 3 or 4 beds and are financially operating to make that work. And so we want to be able to target those beds first, so that those people who might just have an opening come up tomorrow or whatever aren't the first to be targeted for potential closure. So there are programs where they've kept a 4-bed license, but they've operationalized the program to work with 3 people for a long period of time. And so those are the beds that we'd like to have identified first. So that's, in essence, what this bill would do.
Representative Liebling.
Thank you, Mr. Chair. First of all, I'm wondering, was this ever introduced as a bill? Because I have to say, this is, I think, it's great if the department is fine with it, but this is, seems to me to be a policy issue that probably should have gone through the policy committee, and I wonder if the testifier could speak to that. Why is this coming in kind of way at the end now?
We were notified fairly recently that the bed limit hadn't been achieved, the numbers they were looking for. The department called kind of as a courtesy to say, hey, we're still short beds. And so we were trying to quickly put something together that would give some direction to try and prevent harm to programs so that it wouldn't be possible to just not have any rhyme or reason as to why a bed would be taken. And the department had told me that within current statute, they're able to look at vacant beds. That's one of the things that they can take. And so we just wanted to give some direction as to which vacancies that would be. So it was because we didn't have information earlier that we weren't able to do anything earlier.
Representative Liebling.
So, Mr. Chair, so when exactly did you learn about this?
About a week ago.
Okay. Okay. Thanks, Mr. Chair.
And Representative Norton is next.
Yeah, I'm just kind of going along this same line. And yesterday, people can certainly do what they want with amendments, but I did say I had heard from folks that we were going to try to keep this a finance bill and not have a lot of policy in it. So I'm hearing the urgency here about this. That's a new thing, and I know we have other policy. I'll have one myself. Is there some assurance? It started as a funding bill. It's not going to be anymore. But do we have assurance that these aren't going to be removed in Ways and Means or at some other point? And if that does happen, is there a way that these could be kept as a group and then put on, say, an omnibus policy bill? I'm just looking at, hearing that here's an urgency. It's just been identified. We're putting it in a finance bill. If it's taken out, do we know if it'll be cared for in the process somehow?
I've been told by the chair of Ways and Means that they want to minimize the policy part of this, but my guess is that it will stay in the bill if we adopt the amendment.
Thank you. And so I'm just going to kind of ask the chair, as you move along in this process, I don't know how long I'll be involved in the process, but if policy does start falling out, if you could kind of commit to working with the policy chair to make sure these pieces aren't lost, work closely with her and see if we can't carry them on.
Well, we could, if that did happen, it seems to me we could do an amendment on the floor to put all those things back in there. And Representative Liebling, if you wanted to respond to that.
And Mr. Chair, to that point, I think it's sort of, rather than kind of putting this on Representative Huntley to track this stuff, I think it's sort of incumbent on the advocates of these pieces of policy to come to me and make sure that they are considered when we get our omnibus policy bill to the floor, that these are considered for an author's amendment. And it's great that if enough members have heard about them and there's no objection to them, perhaps they can go in as part of the author's amendment on the floor to the policy bill. So it's not a problem that we're, obviously hearing about them here. I guess I would say that, if members feel that this is important and it's not controversial, and then we should just perhaps not put it in the finance bill and just kind of hold it aside for the policy bill author's amendment.
Representative Loeffler.
Thank you, Mr. Chair. And there's a reason why we ask things to go through the policy committee, so that there's public notice and so that everybody who might have an interest in this has a chance to think it through and react. And I don't represent a sparsely populated area of the state, but we definitely have rural areas where there isn't a lot of people. They may have had a bed vacant because someone passed away, and that saying that that bed goes to the first one to be permanently removed may limit the opportunities for families in that sparsely populated area to ever get someone into a close-by home place. And so, I think there's issues about geographic, equity and things like that that probably should be weighed as well. And so I'm really uncomfortable voting for this with just, one group and the department having a discussion without having heard that others that might be affected. Because I really do think in those sparsely populated areas, we may want to reserve bed capacity because people with disabilities are born and come into adulthood and need this kind of housing throughout the state. And we may be limiting too much the rural areas. I don't know where the vacancies are right now. I have no data on any of this, but I'm just a little uncomfortable about just saying this is our one priority rather than DHS working it out as they have over the last year.
Representative Abler.
Thank you. Well, there's two topics. One is the merits of the amendment, and the second is the method of the amendment. The custom has been you try to keep most policy out of the omnibus bills, but it never works that way. There's never been an omnibus bill that has been devoid of policy, and no one has ever, in ways and means, stripped out policy in the name of a pure system. And so it's up to the committee members of the committee to weigh each topic that comes before it and to see what should go. And it's nice when you have a policy committee that can solve all the policy matters, but it's not always possible. Case in point, last night we kicked the whole APRN thing to go to the floor. And that is probably the most controversial, difficult topic. We're going to ask civil law people and education people to decide what an APRN should do about injecting cement into someone's spine or not. And that's going to be an interesting discussion. So you try hard, you try to move things into policy, but at the end of the day, the floor is where all the action happens. The finance committees are the committees of last resort to deal with the matters. And the world and the public knows that, which is why you have a lot of omnibus things that came to the Chair Liebling's omnibus bill at the end that were just fun to catch up, and then things are coming here that are on people's minds. And especially in a short session like we have, where it was very constrained, and where some of the back and forth that happens had no chance to come to fruition. If we have an 8-week deadline on policy, on week 1 you kind of get settled, here's the office, get the snacks stacked up, and then you have your appointments start rolling in, and you meet your members for and by week 3 there's some new ideas that are evolving that because you haven't seen them all interim. And then in week 4 you get the bill in, and there's a hearing on week 6, and it moves along. Well, that didn't happen at all this year. If it wasn't almost pre-filed, it didn't get done. And there's some really important work and some things I have that are really important for things we care about. And so I hope as we move forward today we can look at the content. And just in terms of the process, this is the beginning of the process. Even though it's the end of the committee, then it goes to Ways and Means and the floor and into a conference time, and both sides will haggle. And that's when our best work happens. And so, Representative Loeffler, for your question, for the people and wherever they're living to know this is alive, if there's an amendment adopted, then they can react to it. If there's something floating around that's going to be in the Senate, not in the House, or go on the floor, they have no way to track that. And in this particular topic, this has been a mess. And so the advocates who represent those who have the rural beds, greater Minnesota beds, and Metro ones have worked to find a way to make this the softest landing possible and inconvenience the least number of people in the least hurtful way as we move people into community-based settings. So I hope we can adopt it today. And on the other topics, if we can, this is my long comment about all these, so it'll be spared later. But it's prudent. We are the ones who understand this topic. If it's ever going to happen, it should happen here, and then it can go into the grist mill of the rest of the system. So thank you, Mr. Chair.
Representative Lane.
Well, you said that we're the ones that understand this. I guess I need a little more clarification. As I read the words that are not added to the statute, the commissioner will delicense 128 beds by June 30th, 2014. We're really close to that, using the needs determination process and continuing the words that are already there. They have the authority to manage statewide capacity and meet the statewide needs identified through the process in this paragraph. So my question is, what is it that they don't have that they need in this additional language? I don't understand that.
Mr. Chair. Well, I can comment. Then maybe Mr. Nelson or Mr. Turner. This gives them some criteria, thoughtful criteria. Sometimes they would just, otherwise they could randomly choose a very poor choice and meet the criteria. So I'll let the witness testify.
Mr. Nelson, do you want to respond? Or?
So what we're trying to do here, it's not directing that they have to do anything, but we want them to consider first looking at those beds that may have no impact financially on the homes to destabilize it, because there's language earlier in the bill that basically says when a person leaves, that bed will close. And in doing that without any kind of sense of direction, we could very much destabilize the system, because if you close a bed in a program, you in essence are getting rid of that program, because programs can't operate at not full capacity. But there are situations where people have the resources for people living there. It only takes 3 people to make that program operate, but they've kept a 4-bed license just kind of to have that extra bed kind of in hand. And there were also counties that, when they knew the moratorium was coming, increased license capacity for some of their programs to, again, have some extra capacity. And so we just would like to be able to have them consider those, taking a first look at those. And again, they still have choices about what they actually take or don't take based on the needs analysis and the other things they've done. But we do want to just give some direction to say we know there are some programs out there, and we're hoping there might be up to 35 of those beds, so that in the end no one's harmed and no one's forced to close and no one's got any negative ramifications.
Mr. Chairman, may I add to that?
Mr. Nelson.
Very briefly, Bruce Nelson from ARM. First off, this is, from day one, was a finance committee issue. It's a way to book some savings, and that's how it rolled out. In the course of implementing this, Representative Lane, you referred to some of the things in law. There's things in other sections of law that pertain to this as well. And many of those items, for example, voluntary closure process, didn't happen until more than a year and a half after it was enactment of that. Some of the statewide capacity studies are, in my mind, incomplete. And so we've come to a point where some of the mechanisms to get us to the 128, as a finance committee item to book savings, we're behind on. And so that's why we brought it to the committee today. We just found out about it just over a week ago. And so as they narrow it down, we want to make sure there's the least amount of harm and maybe no harm at all. And so that's why we're here today. And that's some of the history, in the law that you referred to.
Representative Liebling. Excuse me. Representative Kwan was next.
Thank you, Mr. Chair. And I agree with the point about looking at what the existing language is, up to 128 beds. So there, we are trying to, with this amendment, possibly add criteria. And reading the additional language, the commissioner shall consult, I think that's a good thing. And taking into account operated at less than full capacity for 12 or more months, that seems a reasonable addition. And then if later on in line 28, if more than 35 beds, and you've got the commissioner shall prioritize the selection, and that this is based on the length of time the beds have been vacant. So if you're looking at getting rid of overcapacity, it is just the intelligent thing to do to take into account how long beds have been vacant and not used. It also has about looking at where the, not the primary location. This is pretty straightforward, logical approach to adding some criteria, and I'm disappointed that there wasn't other criteria. And having been on the policy committee in the past, I should probably take some responsibility for not introducing, criteria. But as we say, we're starting to bump up to this June 30th, 2014, and adding that the commissioner shall consult and that take into consideration where there hasn't been utilization for a year or more. I don't see anything wrong with adding some logical, common sense verbiage into this statute. So I support the amendment.
Is there anybody from DHS that would comment on this? Here she goes. Welcome to the committee.
Thank you. Mr. Chair, members of the committee, my name is Heidi Hamilton from the Department of Human Services. Up to this point in the process of closing the 128 beds, we haven't had to forcibly close any. They've been able to, we've been able to reduce the numbers through attrition and other means where providers have decided to close or other reasons. We're at a point now where we do have to begin looking at closure. And the law does give us the authority to reduce unused capacity. That's the first thing we need to look at, but it's not defined what unused means. And so I think that this was an attempt by ARM to define how we would look at unused, that they would be empty for a year or more. And 35 is approximately the number of beds that we have left.
Mr. Chair. Representative Liebling.
Well, thanks, Mr. Chair, and I think we sort of understood that this is their attempt. I guess what we're asking is we would like to know how the department views that attempt. Is this language acceptable to the department? Do you feel that does it take away needed flexibility, or, are you okay with us adopting it?
Ms. Hamilton.
Mr. Chair, Representative Liebling, we are okay with this language.
Representative Abler.
Oh, and not to drag this too far, just since you're there, there was this talk about some beds weren't counted in this tally. Have you counted every bed that closed since we passed this law to get to your current total?
Ms. Hamilton.
Mr. Chair, Representative Abler, we have made every attempt possible to count all the beds that have closed since 2011.
Thank you. I'm happy to hear that. Now everybody heard that, so then they'll know that we meant it. So I thank you for your deal. This has been a really hard project, and it's glad we can at least try to soft land it. Thank you.
And, I was pretty ambiguous at the beginning, but Mr. Nelson has convinced me that this was put into law for a financial reason. And so I think it does relate to this committee. Any further discussion?
Oh, I forgot to move it. I'll move the A1 amendment, Mr. Chair. Thanks.
Okay. Any further discussion? I don't see any, so all those in favor of the amendment signify by saying aye. Aye. Opposed? So the amendment is adopted. Okay, and the 825 has now been passed out, and who was
Mr. Chair, I would be glad to move the 825.
Representative Loeffler.
And, Mr. Chair, members, what this does is it changes the income standard for people who are blind, disabled, or over age 65 from 75% of the federal poverty level to 80% in 2017. We would hope to do more progress earlier, but we're going to start ourselves on the way. This will solve a problem for all those groups served and the providers who serve them.
And Representative Loeffler, this is the spend down part that they have to do?
Mr. Chair, this is correct. Right now, people who fit those categories have to spend down to 75% of the federal poverty level. We don't ask that of any other group on MA, and this will take them to 80%.
And what is the fiscal cost?
I would defer to Mr. Berg, who's been in conversations with DHS on this.
Mr. Chairman, members, there hasn't been a formal analysis done, but in conversation with the department and looking at a fiscal note from last year, their early estimate is around $2 million in fiscal 17. We have that much available in the tails, just a little more than that, so we are confident we have enough money to cover 5% for half a year in fiscal 17. And the department's still working on the exact number.
Okay, any further discussion? Representative Quam.
Thank you, Mr. Chair, and I enjoy this amendment, and this question is not meant to reflect on that, but as we adopt, are we keeping a running track of how much of the tail target we have remaining?
Mr. Berg.
Mr. Chairman, Representative Quam, yes. Going into this, we have $2,949,000 from our tail. At an estimated $2 million, this would leave $949,000 in the tail, but I would suggest we want to leave a little fudge room on that in case the analysis on this comes in a little higher than that number, the $2 million number.
Representative Mack.
Thank you, Mr. Chair, and thank you for the clarification on that, Mr. Berg. And Representative Loeffler, I'm torn because I agree with you on this amendment in the terms of the policy and these spend downs, and they're sometimes irrational. But I do look at the amendment with just some concern with the fiscal implication. I'm already pretty uncomfortable with the tails that we already have on this bill, and I understand that within the goal, if I remember from the other day, the goal is to keep the tails under, I think, $580 million, or give or take, Mr. Berg. Is that correct?
Mr. Chairman, Representative Mack, the number is $581.2 million.
Mr. Chair, and members, thank you for that. I just, so I guess there is money within that goal, but I just think members should be cognizant that's still in the tails. That means that it's spending that we don't necessarily have money for in the future that we're going to have to figure out how to pay for then. And so I just face this amendment with a little trepidation, Representative Loeffler, just with that in mind. And if it's responsible for us to do that and continue to up those tails, with many amendments to go that probably have fiscal notes that are going to want to push us north of that. And so, members, I think it's something that's important to mention and keep in mind as we deal with this amendment and several others and what we're looking at in those tails and the reality of that. Thank you, Mr. Chair.
Okay, any further discussion of the 825 amendment?
Is that number there?
All those in favor signify by saying aye. Aye. Opposed?
No.
The 825 is adopted. Now we're going to go to A4. A4, which is Representative Abler.
Thank you, Mr. Chair. Thank you very much for the timing of this amendment. This has to do with the Eagle's Healing Nest and would allow that come July 1st, 2015, it could contract directly with the state to deal with the needs of these veterans. This was heard extensively in the policy committee. It was very popular. It really shouldn't cost any money, although it does have some tail costs, and I believe that's within the capacity it's left. If you're going to spend $1 in tails, this would be the group you'd want to look after. And I think most members understand this. I won't go on about it, but it's a remarkable experiment that Melanie Butler and her group has done out in Sauk Center. And I'm in discussions with the county. And if things go well, we don't need this amendment anymore because they'll actually work with these folks. But if not, I think it's important that the legislature demonstrate its will that we are going to look after these veterans who have fallen through the cracks. And Representative Newton and I have been kind of working hand in glove on this. And so I'll just stop there, but if there's any questions, I'd like to move the 8th Amendment, Mr. Chair, and it does go within the tail target.
Comes out of the tails?
Comes out of the tails, and it'll burn up about half of what's left.
You don't know the
We know exactly. There's a fiscal note, and Mr. Berg could tell you precisely what they're expecting.
Mr. Chairman, this takes the fiscal note and it moves the effective date 1 year down the road, and so pushing that off, it would spend $424,000 in the tails.
Mr. Chair, I just want to echo what Representative Abler said. This is an unbelievable facility that's really taking care of people in need. And I know I get some communications about, whether a veteran is really a veteran or not. This is a place where we're getting people from all over the state being referred by county veteran services officers, by the VA, and other places to find them lodging and get them together. And I have told Representative Abler, for me, it's almost like an ongoing AA meeting. Most of the people there have addiction issues. They also have mental health issues, and they have worked together and continue to work together to take care of one another and keep one another on the straight and narrow. And it's just incredible what's being accomplished. At the rate of, if I'm not mistaken, Representative Abler, it's about $22 a day, I think, that what they've raised to take care of the food and lodging for these people. So it's pretty amazing.
So, Mr. Berg, what does this do to our reserves? Or not reserves, I mean the tails.
Mr. Chairman, they would leave you with approximately $525,000 in the tails below your tail target. Again, the Loeffler amendment that went on, we don't have a firm number yet. It's around $2 million. I would suggest you might want to leave a little room in case that number comes in just a little higher.
And how many other amendments do we have coming that take from the tail?
Do you want me to answer that?
Yes.
Mr. Chairman, I'm not sure how to answer that. There are various amendments here that spend money. Some of them are not balanced. Some, I suspect authors think they don't have costs that the department thinks they do. So at this point, we have almost no room to do spending in 14 or 15 without cutting something that's on the table, and virtually no room in the tails without either going over or changing something.
Mr. Chair.
Well, I like this program, but I think that we need to keep a little more flexibility in the tails, so I would urge members to vote no. So any further discussion?
Mr.
Abler, Representative Abler.
I have the highest regard for you, and I understand the role you're in. Some of the amendments coming are mine, and if there's one thing I do in this session in my career, it'd be this. The men come forward, and their testimony we heard from a few of them at the policy committee. If they had not been rescued by this program, they would be dead. And I'm not trying to intimidate you, Mr. Chair, but we're in negotiation with Stearns County. If they didn't have a moratorium, this would be free. If these men would go to someplace in Todd County or Anoka County with a similar place, it would cost nothing. If my negotiations work out, I won't need this amendment. But if they don't work out, and if they continue to have their self-imposed 6-year moratorium on new GRH beds in a place of high need, then this will be funded. But GRH is forecasted, except in Stearns County, because of the thing. And so, Mr. Chair, I will not ask you for one more penny of any of my amendments except to talk about the merits of some programs. And I think, as a group, I think this is something that we should buy, with all respect, and I would please change your mind.
Representative Norton.
Thank you, Mr. Chair. I think Representative Abler just answered my question, and I'm going to look to the chair because I don't know what other bills. If the only bills left have tails that are Representative Abler's and he's willing to withdraw them, that allows me a little more flexibility. But if there are other bills or other amendments that other people have forwarded that also spend those tails, then that puts me in a position to want to support what you just said. So is there a way we could table this particular amendment till we go through the rest and find out if we have money left? Because I'm inclined to come back to this, but I need to weigh it against what's left to come, and I haven't heard what those are, and I respect your the opportunity to withdraw those, others speak to them and withdraw them and leave this, but Mr. Chair, I'm just wondering if that's a possibility.
We could certainly, why don't we go, Representative Liebling had a comment, question.
Right. Well, thanks, Mr. Chair. And I know we're all kind of wrestling with this because, in part, because we have a lot of regard for Representative Abler, and I know he wasn't listening when I said that. But, you know, and I think he's made a pretty compelling case for this group of folks, and they were a pretty compelling bunch when they were here. And I think we all understand his passion for helping them out and making sure this program is viable. And so I think obviously it's probably up to Representative Abler whether he wants to withdraw this for temporarily to let us see what else is coming. But, you know, Mr. Chair, you know, notwithstanding the fact that we probably are taking up wiggle room that we do need in the tails by this, I guess I would, at this point, if he wanted to go forward, I guess I would support putting this on the bill, even though it's a tough decision for the reason that you mentioned. And but you know, certainly I think Representative Abler's been here a long time. He's you know, I think he's really making a strong case for us to, you know, do this one thing, and I think he's saying that he's not going to press his other amendments if we're able to do this, and I think that is, it's a big thing. And so I guess that I certainly think that Representative Norton's given us a good idea, but if he's not willing to do that, I guess I would be willing to support the amendment.
Well, members, I'm going to move to lay this amendment on the table, and if we don't damage the tails through the rest of these amendments, then I move to bring it back up, and I would support it.
Thank you, Mr. Chair. Point of personal privilege. I can't talk anymore since you've moved to table it, so I just have a personal privilege. If you withdraw your motion to table, I'll withdraw it, pending what we do. But it seems to me, and as members understand what we decide to buy, and I think we've already bought the biggest thing we're going to buy, which is this spend-down thing, unless you know what else you wanted to buy. So, but I hope, members, that if we change one thing, it'd be to help this group go forward. So, Mr. Chair, with that, I'll withdraw the amendment. Oh, no, you have to withdraw your
motion.
Then I'll withdraw the amendment, Mr. Chair. Thanks.
Okay. Thank you, Representative Abler. And it's going to be a long evening, but I hope that we're successful at the end.
Thank you.
Okay. The A5 amendment.
Mr. Chair, that's my amendment, and I need to amend it and then move it. And so I've talked with staff, and hopefully I have this correct. I'd like to amend after line 1.4 to strike all the language between 1.4 and 1.23, and then go to line 2.9 and strike 2.9 through the rest of the amendment. Yes. So,
Can staff repeat that? Sure.
what I'm attempting to do is keep lines 2.9 through 2.19. All right, so they said that's not what I just did. Okay, so through 2.26. So I'm going to keep 2.29 through 2.26, and if there's a staff member who would like to read that appropriately, or I could try it again.
So, Mr. Chair, I think the amendment after these deletions would be keeping lines 1.1 to 1.3 on page 1, and then keeping lines 2.9 to 2.26 on page 2. And then technically keeping the revised instructions on page 4, lines 4 and 5.
Mr. Chair, could you repeat that? Could that be repeated, please?
So, Representative Norton, what does this do?
Okay, so...
Just repeat the amendment.
Okay, so, Randall, did you want to try it again?
Mr. Representative Abler, the amendment would be, or I should say, the only thing remaining after the motion to delete would be lines 1.1 to 1.3 on page 1, so we'd keep that. Moving to page 2, the committee would keep lines 2.9 to 2.26. This is the section being added. And on page 4, you would keep the revised instruction on lines 4 and 5.
And, Mr. Chair, if I could just speak,
Okay, Representative
speak
Norton.
to this. Thank you. There's a larger kind of an autism omnibus bill that was we haven't had heard this year, and it's quite controversial. We thought we had worked with folks to get something everyone supported and that was cost neutral, and we're unable to do that. So all the advocates and the department seem to be on board with the lines 2.9 through 2.26, and what this does is allow the governor's early intervention autism bill that passed last year. For folks with dual diagnosis, this section will allow them to, this one's, so that can be either a licensed physician or a mental health professional to help with the diagnosis rather than both. And for rural Minnesota and for some folks, it takes a very long time to get two, if they can even find one. I think the department's fine. Well, I know the department's fine. I talked with them right before we came to the floor, and the advocates are fine with this, too. So,
Mr. Chair.
Representative Abler.
There was just a sigh of relief in some parts of the room, so it's a good amendment.
Yeah.
There's much happiness.
Representative Quam.
Thank you, Mr. Chair. So my understanding is there's no need to change March to July 1 for sections 1 through, that basically the effective date change can come out?
I think we took it out, Mr. Chair, in the amendment. So we'll just whenever the bill passes, and it will go into an action.
Mr. Chun, is that section still in the bill?
Mr. Chair, I guess the motion kind of on the table would have been to remove the effective date change, which I think delays some of the provisions, but I think it's a question of the author's intent.
Representative Norton.
I think for ease of the committee right now, let's just leave what we've amended and have the effective date happen when the bill passes.
Okay. Any further discussion? So, Representative Norton has moved an amendment to the A5 bill. All those in favor of that amendment signify by saying aye.
Aye.
Opposed? So the amendment to the amendment is adopted, and now we have the A25 or A5 amendment as amended. Any discussion on that? All those in favor signify by saying aye.
Aye.
Opposed? So the A5 amendment as amended is adopted. Yeah. Okay. Representative Quam has the eighth with 7. And I would say, Mr. Quam, that I have already added something in the bill that kind of addresses, does not, it just says must be geographically balanced.
Mr. Chair, thank you for that. What is the standard definition of how they divide up the geography, and to what precision is balance?
Yeah, I just wanted to give the commissioner some flexibility to deal with this, and I think she will do a good job of making sure that we have people from all over the state on this committee.
Thank you, Mr. Chair. And then I would take that the intent of my amendment is covered with your change, and I would just, the curiosity with my previous question was the Metro is sometimes 7, sometimes 11 counties, sometimes based off statistical analysis that the feds use, et cetera. So I withdraw my amendment.
Okay. Thank you, Representative Blum. A9 is Representative Abler.
Mine, Mr. Chair, and I don't know if this costs money. I don't know if Mr. Berg has an opinion. I know we've been trying to analyze for-profit HMOs, given the passage of the ACA and the premise of interstate purchasing coming, and we're going to have more plans coming into the state. It seems like we should actually, since we're like HMO Mecca, we should know what the difference in profit and for-profit is. And I don't even think the health plans object, and it would give them actually one more member if they actually of their health plans. But Mr. Chair, I can't tell you if it costs money. Do you know offhand?
Mr. Berg.
Mr. Chairman, you may wish to have DHS comment, but since in the wording in line 1.6 is that the commissioner shall contract, I'm pretty sure that will put a cost on this. I don't know if the department wants to comment on.
Mr. Chair.
Does anybody from the department wish to comment on this?
Yeah. Mr. Chair, would it be sensible to make it May and then let them do it if they would like? At least they'd have the authority to do this. We haven't even gotten that authority to them. So maybe I'll just make an oral amendment, Mr. Chair, I'll move the A11 and then on line 1.6, delete shall and insert may, and I'll incorporate that as a oral amendment. And then we can talk about the idea, if you want, at least let them maybe work on it sometime.
So what's your amendment to the A9?
On line 1.6, delete shall and insert may. And they can still comment if they want.
Here's somebody from the department.
Mr. Chair and members, my name is Abigail Mosier. I'm the CFO at Health. And we were able to pull out a fiscal note for the same language from the 2012 bill, House File 2116. And at that time, we did fiscal note this provision at $79,000. That included $55,000 for the contract. Recent experience with some other contracts makes us think we need to go a little higher to get a better product. Our best guess on the fly would be about $105,000 total, but we'd leave it to the committee to decide.
Okay. Mr. Chair, I'll stick with...
Your amendment would change the shall to may.
And then they could do it if they want, if the money should pop up, and then it becomes moot. At least it's in there. So if members want to maybe work on this, that's the best we're going to get. And I don't want to take away money from my other project anyway. So, but that would be this is this biennium anyway, so it wouldn't affect that. So, Mr. Chair, what's your pleasure about that is my question.
You have moved the shall to may, right?
Yes, Mr. Chair.
So, all those in favor of that motion signify by saying aye.
Aye.
Opposed? So the shall has been changed to may. I still think Representative Alvers.
Thank you, Mr. Chair. I have a lot of concerns about this particular amendment and the direction that we're giving to DHS, even if it is a may. I think that Minnesota, as many of the people in this room know, but I'd say a lot of people outside this room don't know, requires our HMOs to be nonprofit and has since, 1992? And it's resulted in a situation where the health care dollars that we spend in this state going to health care rather than going to shareholders. And we've seen that benefit Minnesotans in many, many ways, including the fact that we have a really great partnership with our HMOs in the state. And additionally, we have a lot of competition in the state that other states don't, that allow for-profit HMOs, because the market share gets eaten up very quickly and people drop out of the market and there's a lot more turnover. And so
the way that this amendment reads and the way that it's directing the HMO, the study on the for-profit HMO, I think, does not really provide balance with what we're currently getting in Minnesota with our nonprofit model. And so I have a lot of concerns with directing the DHS to do this study. So I would oppose it.
Representative Loeffler.
Well, thank you, Mr. Chair. And this is like a major thing that would affect what is available in the market to everyone in the state of Minnesota. And I just really feel it needs really thoughtful consideration. Typically, it would go through the Commerce Committee in addition to the Health and Human Services Committee. It doesn't address the impact of people who aren't on public programs, which I think would want to have their interests represented in anything we do. And I'm just not prepared to say we can authorize this, signaling a change in potential direction without a lot more work on it. I'm sorry. I just don't think this is the venue to take this up without it looking at more broadly at the entire market and all the impacts.
Mr. Chair.
Representative Abler.
Well, not to prolong it, this amendment has been around for a decade or something. And so if you've been here a while, you've seen this. This has been heard and not done for about ever. And it just seems to me, and I can count so I can figure out how this is going to work out for me today, but I just want at least, before the amendment, the other one's still alive, before this amendment expires in untimely death, I would like to have actually people read the amendment and say, it says, could we please evaluate, like if United Health could be productive in Minnesota? If you ever gone to their place and looked at their data metrics, it is remarkable. People everywhere in the country use them but us, and there's other ones too. There's a whole raft of them, and in the provider side, I'm worried about sometimes the for-profit ventures and how they might be disinterested in quality. But if we don't ever ask the question, we're never going to know. And so two of the metrics I asked them to evaluate would be, would it affect would it affect costs, which are a big deal in this bill. We have just loaded up $750 million of unforeseen costs into this bill from last session, which is not a small matter. So maybe we could reduce that to $500 million. It might be useful. And we also care about quality. And it says, could the quality, if it could be less expensive and better quality, why wouldn't you want to do that? Mr. Chair, I won't belabor it, but someday we're going to do this, and we'll go like, wow, could have had a V8. There really is, there is some benefit. People can choose. Thank you, Mr. Chair.
Representative Grunhagen.
Oh, thank you, Mr. Chair. I'm drinking the same fruit juice Representative Abler is, okay? And I don't like V8. Yeah, I know. Well, I haven't said anything, so I thought I'd start off with a bang. But anyway, on a more serious note, and keeping this moving, this has the potential to increase competition, and basically the state of Minnesota has pursued a course of reducing competition in the state, and here we have a study that might actually increase competition, and obviously we all know that competition helps bring costs lower and creates efficiency in all those involved. It does for me as an independent insurance agent when I got to compete against these larger companies and other agents for people's business. I try to give them the best value for the best dollar. It's a continual fight, and it makes me a better agent, I think, and it would make our HMOs in the state better HMOs if they had additional competition. So I would support this amendment. Thank you, Mr. Chair.
Representative Mack.
Thank you, Mr. Chair. And just briefly, I do hear and appreciate the concerns of this being a broader discussion that Representative Loeffler brought up and the points made by Representative Halverson also. But I do think it's important to realize this is a study. This gets a conversation going. I think we're looking at some pretty scary situations in the next several years in terms of our managed care population and the costs with that. And so I don't see the harm in just getting more information into our hands about other options that might be on the table that up to this point we haven't really taken a hard look at. And so Mr. Chair, I just think that this is a prudent thing for us to do as a possible another option to better manage our costs. And so I would hope members would support it just so that we can do a study. We're not taking any major policy change here. This is just getting more information into our hands to make better decisions in the future. So thank you, Mr. Chair.
Okay, any further discussion? I'm a little concerned about telling departments they may do something, and it seems to me it's our job to tell them what they should do. All those in favor of the amendment signify by saying aye.
Aye.
Opposed?
No.
The amendment is not adopted.
By this much.
Okay, where are we at now? A9? A11? Representative Abler, A11. You were very busy this week.
Mr. Chair, and this was just meant to call attention. Actually, at one point there was a few $1 million left in the tails, and your bill can't afford this anymore. But let me just, I'll move to A11, and then I'm going to withdraw it. But you have a bill that spends $75 million in general fund in this biennium and $580 or so million in the upcoming biennium. And in that bill, you're doing lots of fine things, but one of the things that we're not doing that could be the finest things, as we look at disparities and the population health of the people of the lowest economic groups, and these FQHCs are there week in, week out on the front lines, stretching dollars beyond imagination. And and this is not I think on a bipartisan basis, we think these groups are awesome. But somehow they always get starved. And we put $1 million for this, $1 million for that, and this group, if you gave them $1 million, you heard what they would do with it, and it would actually change outcomes of people. We have all these expensive things we do at the Department of Health and DHS to evaluate what's going to work. We have new pilots. Yet this old model, is actually working really well. And they're scattered around the metro in particular, and some are outstate. And where they land, health outcomes improve in that little world. It's like a petri dish where you have a little thing and the bugs die around that. That's not a very good analogy, Mr. Chair, but but they make a difference in their communities. I'll say it that way. So I wish there was a way, and I hope as things go forward here, that in the future that we will recognize that the first dollar to put toward doing something to make a real difference in some of the lives we're talking so much about would be here. As we look at MNsure, which is just going to consume tens of millions of dollars and not give any health care, if you would have put 1/10 of that money into these people, you would have seen some health care improvement. So I'll stop, Mr. Chair. I sadly withdraw the A11 amendment.
Okay.
Thank you.
Thank you. And Representative, or the whole committee here, I think we're all so tired that we can't get mad at each other anymore. Amen. And so with that, we're going to go into recess to the call of the chair.
You just leave.